can start now.
So, good evening, all. Today's topic of discussion is Agni Karma. So, before I speak, let me know what is your idea on Agni Karma. Whether you have seen the procedure at Agni Karma and what is your idea on that topic. Annapurna, can you hear me?
Yeah, ma'am.
Okay, so
Happy Doctor's Day, ma'am.
thank you. Same to you.
Thank you.
So, Agni Karma. Whether the procedure is done in your college, whether you have seen the procedure. So Agni Karma has been given special place in Shalya Tantra by Acharya Shushruta. In the previous classes, we have seen about introduction to Shalya Tantra, we have seen about the Yantra, Shastra, etc. So if you remember, you know, in the definition of Shalya Tantra, there was mentioning of Agni Karma. Similarly, when we discussed about Yantras and Shastras, we have seen that this Agni Karma is included as one among the Upayantra as well as one among the Anushastra. And when we saw the definitions of Upayantra and Anushastra, we know it is not that much superior to Yantra or Shastra, but it is told like Upayantra is something that is Yantra Samipa Vartini, that is almost similar or near to the Yantra, and Anushastra is Shastra Sadrisha, something which is similar to Shastra. So, in that way, also, when we take, we can understand the importance of Agni Karma. And in addition to that, the approach of Agni Karma has been mentioned in the context of various diseases like Arshas Chikitsa, Bhagandara, then Gata Vata Vikaras like Sirasna, Ivasti Sandhigata Vata Vikaras, Gridrasi, etc. In the treatment part, we can see the application of Agni Karma. Okay, so now we will see about the references in the Samhita. Here I have taken Sushruta Samhita reference mainly, but I have included the Ashtanga Hridaya and Sangraha references also, but I will be stressing on Sushruta Samhita. Okay, you have got the notes.
Yes, ma'am.
Okay. So first shloka is about the Agni Karma Mahatva. And the shloka is Ksharad Agnir Gariyan Kriyasu Vyakhyata Tad Dagdanam Roganam Apunarbhavat Bheshaja Shastrakshare Rasadhyanam Tat Sadhyatvacha. That is by Acharya Sushruta. And Acharya Vakpata also explains the same concept Agni Ksharad Avisreshta Tad Dagdanam Asambhavat Bheshaja Kshara Shastraisha Na Siddhanam Prasadhana. So it is told here in the shloka it is told that Agni Karma is considered superior to that of Kshara. Why it is compared to Kshara? Because this Agni Karma Vidhi Adhyaya is explained next to Kshara Karma Vidhi. Also, in the Kshara Karma Adhyaya, it is told Kshara Karma is the Pradhana Tama among Bheshaja Shastra, means Yantra Shastra, all when we take. In that chapter, it is told like Kshara is the Pradhana Tama Karma. So, a comparison is done with Kshara and it is told Kshara Dagnir Gariyan Kriyasu. So, when we take those two statements made in those two chapters, in the first chapter of Kshara Karma, it is told that Kshara is Pradhanatama. And in the next chapter, it is told Kshara Dagnir Gariyan. So, to substantiate that, it is told that Kriyasu. So, here in the commentary, it is told it is not about the guna. While explaining Kshara Karma, it is told about certain gunas, how it is acting, all those things. And there, how it is, how Kshara is Pradhanadama, that is explained. So here in the commentary, it is mentioned that Kriyasu, that is in terms of karma, Agni Karma is considered superior than Kshara Karma, not in terms of guna. So we should not contradict that two statements. And it is told why. The reason is told in the same shloka. Tad Dagdanam Roganam Apunarbhavat. First reason is Tad Dagdanam. So here the treating by Agni Karma is by Dahana procedure. So the diseases which are treated by Agni Karma will not recur. Apunarbhavat. And the next reason is told is Bheshaja Shastrakshare Rasadhyana Tatsadhyadvacha. All those diseases which are considered asadhya by the man, means by Bheshaja, Shastrakshara, all these, that diseases are considered as sadhya when treated by Agni Karma. Because of these two reasons, it is told that Agni Karma is superior to Kshara. Kshara is taken here because Kshara is already told as the Pradhanatama Karma. So, if we consider the probable action of Agni Karma, it is like the Agni Karma is having, means when we consider the disease as such, in certain conditions it is acting as a mode of treatment for relieving the pain. And next is directly on the disease as such. So, two concepts are explained here, that is, due to the Ushna Lakhu Sara Guna of the Agni Karma, there will be Vata Shamana, which in turn will act as Vyadhi Shamana. That is one concept wherein we can take the pain feature more. Next is when the Vyadhi as such is taken, we know there is a concept that due to Dhatu Agni Mandya, the Vyadhi is occurring. So here, due to this Agni Karma, due to the Ushna Guna of Agni Karma, it will act on the Dhatu Agni, where the disease is caused by Dhatu Agni Mandya. This Ushna Guna of Agni Karma will act upon Dhatu Agni and it will cause Utkleshana of Dhatu Agni. This Utkleshana will help in the Ama Pajana, and further it will act as Vyadhi Shamana. This is the probable mode of action of Agni Karma. Next is the classification. When we see the classification, there is no clear-cut description about the classification of Agni Karma in Ayurvedic literature. We cannot get the shlokas regarding the Bheda, but by the detailed description when we take, we can classify according to the concept, and based on that, the Agni Karma can be classified according to the dravyas used. According to the dravyas used, there will be two classifications, that is Snigdha Agni Karma and Ruksha Agni Karma. Snigdha Agni Karma, when the Agni Karma is performed by means of Snigdha dravyas like Madhu, Krita, Taila, etc. When these materials are used for Agni Karma, that comes under Snigdha Agni Karma. And Ruksha Agni Karma, when Agni Karma is performed by means of Ruksha substances like Pipali, Shara, Shalaga, etc. Those kinds of Ruksha substances are used for Agni Karma, then that comes under Ruksha Agni Karma. That is the first classification. According to dravyas used, Snigdha Agni Karma and Ruksha Agni Karma. Next is according to sight. Sight here means we know in further classes and all we will see when in Chikitsa, when we see some diseases, it is told like Agni Karma have to be done at the site of the disease, and in some cases it is the location of Agni Karma is told somewhere else other than the site of the disease. Somewhere else it is told about the application of Agni Karma. So based on that site of application, it is divided into two: Sthanika and Sthanantariya. Sthanika means local, that is at the site of the disease, like Arshas, Kadara, etc. At the site of the disease, we will be doing Agni Karma. So on that basis, it is Sthanika. And Sthanantariya means distal to the site of the disease, like in Vishujika, Apaji, Gridrasi, etc. The Agni Karma have to be done in other places other than the site of the disease. So that is the next classification based on the site: Sthanika and Sthanantariya. And next is according to Akriti. That you will see in detail. It's not 8, it is 7. 7 types according to Akriti. Then fourth classification is according to Dhatu. That is the level of application of Agni Karma. There are 4 types: Twagdagda, Mamsadagda, Sirasnayudagda and Sandhyasthidagda. 4 types according to Dhatu on the level of application of Agni Karma. So thus the classification can be done based on dravyas used, based on the site of application, based on the akriti, means the shape, means the pattern in which the Agni Karma is done, and based on the dhatu, that is the location, the level of application of Agni Karma. So that is the classification. Next is the Dahanopakarana. Dahana Upakarana means the various accessories which are used to ma. And the sloka is Adhema Udanda Sharashalaka Jamba Oshti Itara Loha Kshaudra Guda Snehascha. That is by Acharya Sushruta. In Acharya Vakpada it is told Varti Godanda Surya Kanda Sharadibhi Madhu Sneha Jamba Oshta Budadibhi. So these are the materials that can be used for Agnikarma. And when we consider this materials, that can also be classified based on the origin. That is when we see the materials like Pippali and here in the commentary it is told like Madhu, Chishta, Sarjaras, all those also can be used for Agnikarma. So when those substances are taken, we can see that they are plant origin. So based on that origin, again it can be classified as the Upakaranas of plant origin, Upakaranas of animal origin, which includes this Aja, Shakrat, Godanta, etc. as animal origin. And next is Itara Loha, that is metallic. So based on that also there can be classification, Upakaranas of plant origin, animal origin and metallic origin. So these are the different accessories told for Agnikarma. I think the meaning Pippali, you know, Aja Shakrat, that is the pieces of the god. Then Godanta, you know, Shara is arrow, Shalaka, you know, Jamba Oshta means the Oshta, the stone which is similar to Jambophala, the shape which is the stone which is having the shape of Jambophala. Itar Loha means all those lohas, all those Tamra, Raja, all those substances will be included in the Itara Loha category. Then Kshaudra, Guda and Sneha. Kshaudra is honey, Guda is jaggery, and Sneha any kind of Sneha dravyas. And by Acharya Vakpada, the materials are Varti. Varti means Pichu Varti. The same Varti can be used for Agnikarma. Then Godanda is same. Suryakanta means Svatika. Then Sharadibihi, same thing only. Shara, Shalaka, all those things are mentioned. It's Adi Shabda is uh, mm, that with that Adi Shabda it is meant like Shara, Shalaka, Jamboshta, same. That in the commentary it is mentioned like that. Then Madhu Sneha, Jamboshta, Gudadibihi. Same drugs are told by Acharya Vakpada. That is about Dahana Upakarana. And next is where to use these. And so many Dahana Upakaranas are mentioned. So next is where these have to be separately used. And it is told Tatra Vipalyaja Shakrat Bodanta Sharashalaka Tvaggadana Jamboshti Itara Lohatana Kshaudra Guda Sneha Siras Nikarma. If the Nikarma have to be done at the level of Tvag, if it is Tvaggada Rogas, then we can use the substances like Pippali and Shalaka, all these can be utilized if it is Gata Vyadi. Next is Jamba Oshti that can be used when it is Mamsagata. And Kshaudra Guda Sneha can be utilized when it is Sirasai Sandhyasti Gata. So based on that, this Dahanopak description by Acharya Vakbhatta also. So that is about Dahana Upakarana. This next is Dahana Vishesha. Dahana Vishesha here means the pattern.
Hello.
So next is Dahana Vishesha. So what is the pattern of the Agnikarma? Means how the Akriti. Earlier we have told about the classification according to the Akriti. So that is told by Dahana Vishesha. First is according to Acharya Sushruta, that is Tatra Valaya Bindu Vilekha Pratisarananiti Dahana Vishesha. So four types are told by Acharya Sushruta. Valaya means circular, and in the commentary it is told Yathe Mule Valaya. That is at the root of the disease. in a circular pattern when the Agni Karma is done. That is called Valaya. Next is Bindu. Bindu means Bindu river, like a point, dot like shape. That is Bindu. And next is Vilekha. Vilekha in the commentary it is told Titya Krujuvakra Vividhaleka Vileka. That is different shapes, making of different shapes by heated shalaka. Vileka can be again divided as Tityak, that is oblique, Riju, that is straight, and Vakra means zigzag. Okay, so in different patterns, when the Agnikarma is done, that is considered as Vileka. And fourth one is Pratisarana. Pratisarana is told like Kharshana, that is rubbing at the indicated site by heated shalaka. That is called pratisarana. These are the four types mentioned by Acharya Sushruta. And according to Acharya Vakphata, another three patterns are added. That is Arthachandra, Swastika, and Ashtapada. Arthachandra means crescent shape. Swastika is, while we have discussed about the yantra, Swastika yantra, we have seen the Swastika pattern, four limb pattern. Then Ashtapada means the specific shape containing 8 limbs. These are the three additional Akriti told by, three additional Dahana Vishesha told by Acharya Vakphata. So according to Acharya Vakphata, the Dahana Vishesha are 7: Valaya, Arthachandra, Swastika, Ashtapada, Bindu, Rekha, and Pratisarana. Next is Agnikarma according to Dhatu. So the sloka when you see Tatra Dvividham Agnikarma Mahurege Tvagdagdam Mamsadagdam cha Ihatu Sirasnayu Sandhyastishopi na Pradishiddo Vakti. So in the beginning we have seen that on the basis of Dhatu, the Dahanopakarna was divided. But here when Acharya is numbering the Agnikarma types, it is told Dvividha. Only he have mentioned about Tvagdagda and Mamsadagda as main. But he is adding that Sirasnaya Sandhyastishopi na Pradishiddo. That it is not contraindicated. Agnikarma is not contraindicated in Sirasnaya Sandhyasti Vyadhis also. But he is giving emphasis on Tvagdagda and Mamsadagda. That is by Acharya Sushruta. But Acharya Vakphata have included all the types, means in equal importance, like Tvaji Mamse Sirasnayu Sandhyastishu Sayujyate. And next is how to understand that it is Tvagdagda, Mamsadagda, or the other ones, the features. It is told by Acharya Sushruta, that is Tatra Shabda Pradurbhavo Durgandada Tvak Sankojasya Tvagdagde Kapoda Varnata Alpashvaitu Vedana Shushka Sankuchita Vranata cha Mamsadagde Krishna Unnata Vranata Sravasa Nirodhascha Sirasnayu Dagde Ruksha Arunata Karkasha Stira Vranata cha Sandhyasti Dagde. So the features like if there is production of sound, Shabda Pradurbhava, if there is Durgandha, bad odor, and if there is Tvak Sankoja, that is contraction of the skin, then it is Tvagdagda Samyak Agnikarma Lakshana. Samyak Dagda Lakshana in the Tvak level. Next it is about Mamsadagda. That is, there will be Kapoda Varnata. Kapoda Varnata means color like that of pigeon, that ashy or grey color. Then it is told Alpa Shvedu Vedana, and there will be associated swelling and pain, which will be mild swelling, Alpa Shvedu and Vedana, mild swelling and pain. Then Shushka Sankuchita Pranada. Shushka Sankuchita Pranada means dry contracted wound will be there at the site. That is the signs of proper Mamsadagda. Next is Sirasnayu Dagda. Sirasnayu Dagda, Krishna Unnata Pranada. That is black coloration will be there. Unnata Pranada means elevation of the site. Stravasa Nirodhasya. Stravasa Nirodhasya means there will not be any discharge from the site. There will be cessation of the discharge. When these features are seen, we have to understand that is the sign of proper Sirasnayu Dagda. And the fourth one is Sandhyasti Dagda. And in Sandhyasti Dagda, there will be Ruksha Arunata, dryness, dark red coloration, Karkasha Stira Vranata. Karkasha Stira Vranata means there will be that Vrana, at the site of Agnikarma, there will be roughness, and it will be fixed. It will be a stable, there will not be mobility. So if those features are seen, then it have to be understood that it is the sign of proper Sandhyasti Dagda. So that is the description for Agnikarma according to Dhatu. So Tvagdagda, Mamsadagda, Sirasnayu Dagda, and Sandhyasti Dagda is told. And accordingly the features are also told when Agni Karma when what are the signs of proper Agni Karma on these levels Vagdagda, Mamsadagda and Sthirasnayu Sandhyasthidagda. What are the features which will be seen on doing Agni Karma? Next is Agni Karma Kala. Agni Karma Kala, according to Acharya Sushruta, Agni Karma can be done in all seasons. Tatra Agni Karma Sarva Ritushu Kuryat. Then an exception is told Anyatra Sharat Grishmakya, except Sharat Ritu and Grishma Ritu. Maybe because Sharat season there is the in Sharat season there will be Prakopa of Pitta. So Agni Karma is also aggravating Pitta. Means when the season is also like that, there will be Pitta Prakopa, and that itself can lead to various disorders due to vitiated Pitta. Because of that, it is contraindicated in Sharat Ritu. Similarly, in Grishma Ritu also, it will cause Pitta aggravation. So because of these reasons, it is told Sharat Grishmakya. Means except Sharat and Grishma Ritu, all seasons we can do Agni Karma. And uh, तत्रापि अत्येगे अग्निकर्म साध्ये व्याधौ तत् प्रत्यनेकं विधिं कृतं. And again it is told if it is an emergency condition, अत्येगे, if Agnikarma have to be done and it is a must in case of emergency, then in these reasons also, if it is an Agnikarma Sadhya Vyadhi, then there also we can, in these seasons also we can do Agnikarma, but that Pratyanegam Vidhim Durga, certain precautions have to be taken. And what are the precautions? Pratyanega Vidhim Viparita Vidhana, like Shida Chadana, Bhojana, Pradehadikam Kritva. So before that procedure, we have to do so, means take care of something like we have to go for some Shita Upachara, like Shita Achadana, covering the surface, the area of Bhakti means where Bhakti Karma have to be done, that area have to be covered with Shita Achadana. Cold coverings have to be done. Then for Bhojana also, Shita Dravyas have to be given. Then Pradeha can be done locally with Shita Dravya. All these precautions have to be done, have to be taken if we are doing Agni Karma in Sharat and Grishma Ritu. And next is another caution laid by Acharya Sushruta, that is Sarva Vyadhishu Ritushu Cha Pichila Mannam Bhavata, how the diet should be. And it is told we have to take Pichila Anna. Pichila Anna, it is told like Pichila Anna is Shita and it will act as Pitta Hara. So in such conditions we have to, when before the procedure, the patient should be given Pichila Anna. And Modagarbha, another conditions are told like in diseases like Modagarbha, Ashmari, Bhagandara, Udara, Arsha, and Mukharoga, the patient should not be given food. The patient should be kept abhukta. So that is a caution laid by Acharya Sushruta. Next is indication. So when we see the indication, a number of diseases and conditions have been explained in text where Agni Karma is indicated as therapeutic measure. And we can see Shiroroga, Adimanda, all these conditions where the Agni Karma have to be done. Shiroroga and Adimanda, Ru Lalata Shanga Pradesheshu, in those diseases of Shiroroga and Adimanda, Agni Karma have to be done in the Ru, that is uh, in the eye, between the eyebrows, in the Lalata Shanga, forehead, those regions Agni Karma have to be done. And in Vatma Rogas, we have to cover the eyelid with a as it is more sensitive area, we have to take additional precautions to take care of the eye when it is Vatma Roga. So we have to keep cotton or wet clothes have to be kept over the eye region, and then Agni Karma have to be done. Then other conditions like severe pain, Bhagandara, Apaji, all these conditions are considered as indications for Agni Karma. Similar description is given in Ashtanga Sangraha and Ashtanga Hridaya also. These are the indications. The number of diseases and conditions have been mentioned. Next is contraindications. Contraindications, it is told Adheman Agnina Paripare Pita Prakriti Antashonitam Vinnakoshtam Anudrata Sharyam Durbalam Balam Vruddham Hirum Aneka Vranapedanam Astvenya. These are the conditions where Karma is contraindicated. So it is like we should not do Agni Karma in persons who are of Pitta Prakriti. You know what it is. Already Pitta Prakriti means when Agni Karma is done, there will be Pitta Prakopa, so it is contraindicated. Then Anta Shonitam, if there is any internal bleeding or any kind of bleeding disorders, then also it should not be done. If there is any foreign body retained inside the body and to remove the Shalia which is not removed, in such conditions we should not do Agni Karma. Then the universal cause, these are also considered as contraindication for Pidita. It is told like Aneka Vyadhi Pidita also. Some take it as Aneka Vyadhi Pidita. That is, if there is any complication, if there is already some complications or some other diseases, comorbidities, then also we should not go for Agni Karma. Asvedya. Asvedya, you know, in Panchakarma you might have already learned. Asvedya means Pandu, Mehi, Rakta, Pitti, Trisharta, that's Sweta. All those contraindications for Svedana, same uh, should be excluded while considering the Agni Karma procedure also. That is the contraindications of Agni Karma. So next is Agni Karma Vidhi. We have seen about the indications, means who all can be subjected to Agni Karma. We have seen the Kala, which time it have to be done. We have seen what is the pattern of doing Agni Karma. We have seen what type of food have to be done. All these things we have seen. Now it is the procedure. And a detailed description of the procedure of Agni Karma is available in Ashtanga Sangraha. This is the reference taken from Ashtanga Sangraha. So when we consider the procedure as Purva Karma, Pradhana Karma and Paschat Karma, as Purva Karma, you know, first is the patient have to be clinically assessed, that whether he is a Agni Karma Sadhya patient, whether we can do Agni Karma or not, that have to be assessed properly. Then if the patient is belonging to that Agni Karma Anarha group, the patient have to be excluded. Then as told earlier, Pichila Anna have to be given, and because Pichila Anna is told like it is having Pittagna quality, so we have to give Pichila Anna to the patient. And then after assessing properly the site, everything have to be fixed, and what pattern we have to do, that all have to be fixed, and accordingly which Dahanopakarana have to be taken. All those have to be assessed, and accordingly all the Upakaranas which are required for the Agni Karma have to be kept ready priorly. That is the Purva Karma. Next, about the Pradhana Karma, it is like the patient has to be done Swasthayana, chanting of mantras, offering worships, taking blessings from the elders or Brahmin, all those things have to be done. Then the patient is told to lie in the Prag direction, that is in the east direction, with the head in the east direction, the patient have to lie down. Then it is told, like other procedures, a parikarmi should be there to maintain or to hold the patient in the desired position. Person should be there. And next is, after keeping the patient in the proper position, next is about the instrument. So the instrument have to be heated. And here in this quotation, it is told like the instrument used for Agni Karma have to be exposed to Nirdhuma Agni. And for creating that Agni, it is told that we have to obtain the Agni by igniting wood from the plants such as Khadira and Badara. The wood is specifically told we have to use Khadira and Badara to make the fire. And with that Nirdhuma Agni only, we have to heat the instrument. And the Agni have to be in the upward moving flame. And when the instrument become Bhasura Varna, the Varna it is told like Bhasura Varna, it should be used for Agni Karma. And meanwhile, throughout the entire procedure, the patient should be given courage. And if needed, cold water sprinkling, everything have to be done on the patient. That is the procedure too. So, first thing is about the Pradhana Karma, it is told like, first thing is the patient have to be, means all those Sutyayana, mantras, worships, all those have to be done with the head in the east direction, the Prak Disha. The patient have to be made to lie down, and then a person should be there to hold the patient in the desired position. And then the Agni Karma Shalaka, or whatever the Dahanopakarana is, that have to be heated. And for heating that instrument, it is told that the Agni should be made by igniting Khadira and Badara. With that Nirdhuma Agni, the instrument have to be heated. and then the instrument have to be become Bhasura Varna. That is the apt time or apt heating period. Then Agnikarma have to be done in the desired Akruti, in the desired site it have to be done, and throughout the procedure the patient should be given courage by consolating words, as well as if necessary cold water can be given to drink, or cold water sprinkling can be done. That is Pradhana Karma. Next is Paschat Karma, and in Paschat Karma it is told like Madhu Sarpi Abhyanga. At the once the proper Agni Karma is Samyak the Lakshanas are obtained, we can apply Madhu and Sarpi over the region. Also, it is told like certain other drugs are also told that we will see in the coming sections. Was detailed according to the Dagda Lakshana, detailed Chikitsa has been explained. So that is the Agni Karma Vidhi. Purva Karma, Pradhana Karma and Paschat Karma. So this is the normal procedure wherein different types of shalakas are there now. Swarna shalaka are also used by certain surgeons. Accordingly, whatever shalaka or dhanopagaran is available, that is selected. And now different sources of heat is used. Source of fire, whatever it is available, whatever it is convenient, that can be utilized. Then shalaka have to be heated. Then the area should be cleaned first. Then we will apply this shalaka. The heated shalaka will be applied. And in some cases we will apply Shadasauda Krita. After heating this and after the point is burnt, we will apply Shadasauda Krita. In some cases we will go with Sarpi and Haridra, which will act as Pranaroparna. Then in some cases Kumari Swarasa, aloe vera, along with Haridra will be mixed, and that paste will be applied. That differs. These are the practically utilized techniques. And before the application of this shalaka, we will mark that most tender point. In case of frozen shoulder, in case of low back pain and all, we will mark the most tender point, and on that point only we will do the. That is the usually practiced way. Next is about the Dagda Lakshana. So different kinds of Dagda are mentioned. Mainly it is 4 types. Tatra Plushtam, Durdagdam, Samyak Dagdam iti, Samyak Dagdam, Adi Dagdam chedi, Chaturvidam Agni Dagdam. 4 types of Dagda are told. This is by Acharya Sushruta, and slight difference is like Tucha. Tucha is told by Acharya Vagbhata. Other than that, all the 3 types are same. So Acharya Sushruta tells Plushta, Durdagda, Samyak Dagda and Adidagda. Acharya Vagbhata tells Tucha, Samyak Dagda, Durdagda and Adidagda. And now the features. The features it is told like first is Plushta. Tatra yat vivarnam plushyate adimatram tat Plushta. So what is the Plushta Dagda Lakshana? Yat vivarnam, there will be discoloration. From the normal color, there will be discoloration. Plushyate adimatram, that is there will be severe burning sensation in the site. If those features are there, then it is considered as Plushta or Tucha. Same thing, that is the first type. Next it is Durdagda. Etra uttishtanti spota tivra chosha daha raga paga vedana chirachopashamiti tad Durdagda. Next is the Durdagda type. It is told like when there is etra uttishtanti spota, when there is boils appearing over the site, when there is tivra chosha daha raga paga vedana, all these features like burning sensation, discoloration, when all these are accompanied, then Chirachu Upashamindi, and this boils or the symptoms will take a long time to subside. When these features are present, then it is considered as Durdagda. That is the second type. So first we have seen Pushta or Tucha. Next is Durdagda. In Tucha or Pushta, it is like there will be discoloration and there will be severe burning sensation. There will not be any ulcer formation or any boil formation. That can be taken as first degree burn. Next is Durdagda, wherein there is appearance of boils at the site, and there will be associated discoloration, reddish discoloration, pain, burning sensation, and all these symptoms will take a long time to heal or subside. Third one is Samyak Dagda. Samyak Dagda, it is told Samyak Dagdam Anavagadham Kalavarnam Susamsthitam Purva Lakshana Yuktam Cha. Samyak Dagda Anavagadha. it will not be that deep. Talavarna, it will be in the color of a ripe fruit of talafala. Then susamstita, there will not be an irregularity in the surface, it will be even. And purva lakshana yuktam cha, purva lakshana yukta here means those symptoms or those features which we have told in Dagda, Mamsadagda, Sirasnayu Sandhistidagda. All those features which we have told there, that should be understood by the term Purva Lakshana Yukta. Those features have to be seen when it is done in the Dagda. Those along with this Anavagadha, Talavarna, Susamsida, those features have to be taken. Similarly, the other three also. Purva Lakshana Yukta here indicates that shloka. That is about Samyak Dagda. Next is Adi Dagda. In Adi Dagda, what happens is Mamsa Valambanam, Gatra Vishlesha, Sirasnayu Sandhyasti, Vyabadanam Atimatram, Jwara Daha Pipasa, Murchascha Upadrava Bhavanti. That is when it is Adi Dagda, the 4-degree burn, deep burns we will take. And in such cases, there will be hanging of the burn tissue. Severe burn have occurred, and there will be hanging of the burn tissue. There will be disorganization of the body parts, and the deeper tissues like sira, snayu, sandhi, all these will be destroyed. And in addition to that, some systemic illness like jwara, daha, pipasa, all those systemic illness also will be accompanied. That indicates the complications. And it is told about, that is the systemic complications, and the local complications it is told like pranashchasis chirena rohari, the wound created by this adidagda, that will take a long time to heal. And rudascha vivarno bhavati, that is from that word we can take the scarring or keloid formation, all those complications. Even though it is healed, then also there will be vivarnaga, scarring or discoloration which will be present even after the wound heals. That is the Deda Chaturvidam Agni Dagda Lakshanam. So these are the 4 types of Dagda Lakshanas: Krushta, Durdagda, Samyak Dagda and Atidagda. Next, it is about the Chikitsa. Separately, Chikitsa is told. First is Krushta or Tucha Chikitsa. It is told like Krustasya Agni Pradhavanam Karyamushnam Tadaushadam Sharire Svinna Bhuishte Svinnam Bhavati Shonitam Prakritya Hyudakam Sheetam Skandetyati Shonitam Tasmat Sukrayati Hyushnam Nanu Sheetam Tadanjana. So in Krushta, it is told like Agni Pradhavana. Agni Pradhavana means Vedana only. And Karyamushnam Tadaushadam, we have to do Ushna Kriyas. Using Ushna Aushada, Ushna Alepa, we have to do Ushna Kriyas in case of Krushta Dakta. Why? Sharire Svinna Bhuishte Svinnam Bhavati Shonitam. That is, when this Sharira Svedana is done, the Shonita will also get liquefied. Otherwise, what happens if we use Shita, Prakritya Hyudakam Sheetam Skandetyati Shonitam? When we use Shita, the Shita by nature it is having a tendency to solidify the blood. The blood will float. So to remove the blood or to get the proper vilayana, it is told that we have to go for Ushna Kriyas. Tasmat Sukheti Hyushnam Nanu Sheetam Tatam. So it is advised to use heat and hot therapies, not cold, to treat the Plushta Dakta. Okay, that is the treatment. So in Plushta Dakta, we have to go for Svedana, Agni Pradhavana and Ushna Aushadas instead of Shita Kriyas. Same is told for Tucha also. Next is Durdagda. Durdagda Chikitsa, it is told Sheetam Shinam cha Durdagde Kriyam Kuryat Vishakuna Krita Alepana Sekastu Sheetane Vati Karya. So here it is told in Durdagda, Sheetam Ushnam cha Durdagde Kriyam Kuryat Vishakuna. That is, both Sheeta Kriya and Ushna Kriya can be done in Durdagda. Then will be having a doubt how. It is told in the commentary that Durdagde Avagadha Mula Dagda Bhagasya Swinna Raktasya Nirvapanatam. Clause is told. That is in Durdagda condition, if it is Avagadha Mula Dagda Bhaga, burnt area or the wound created is Avagadha, if it is deep, and Swinna Raktasya, already the Rakta is in the Vilayana form, in the Swinna, it is already in the liquefied form, then we can go for Shita Kriya. And Anavagadha Mula Dagda Bhagasya Asvinna Raktasya, in conditions where the burnt site is Anavagadha, if it is not that deep, And if the rakta there is asvinna, if it is solidified, then to liquefy that blood, we have to go with Ushna Kriya. So, like that, it is told that Shita Mushnam cha Durdakte. Both Shita Kriyas and Ushna Kriyas can be done. Another explanation is given like Shitam Daha Adishaye Nati Dahe Ushnamiti. That is in conditions where there is associated severe burning sensation. In such conditions, Shita Kriya have to be done. If there is not that much severe burning sensation associated with the Dakta, then there we can go with Ushna Kriyas also. That is another explanation given in the commentary. And next it is told like what are the procedures that can be done. Krita Alepana Sekastu Shita Nevaki Kari. And all those procedures like Krita, Lepana, Seka, etc. can be done with Shita only. Shita Kriyas only can be done. That is for the Prana Ropana that will be helpful. That is the Durdakta Chikitsa. Next is about the Samyak Dakta Chikitsa. In Samyak Dakta, certain drugs are mentioned like Samyak Dakte, Tukakshiri, Laksha Chandana Gairi Devi, Samrite, Sarpisha Snigde, Ralepam, Karayet Mission, Gramya Anupa Udagesh Chainam, Pishter Mamse Pralepayet, Pitta Vidradivat Chainam, Santatoshmana Manchari. That is drugs like Vamsharojana, Rakta Chandana, Gairika, Amrita, Guduji. All these drugs can be mixed with Sarpi. And then it will be made into a snigdha alepa. Right, when it is mixed with sarpi, it will become a snigdha dravya. It will be snigdhikrita, and then it can be applied over the site because it will act opposite to that pitta. It means it will be pitta pratyanika. That lepa will act as pitta pratyanika because it is a snigdha alepa that will act on the site and it will help in the healing. Similarly, Gramya Anupodakesh Chainam, Ishter Mamse Pralepe. Another lepa is told using the Mamsa, like Gramya, Anupa, Audaga Mamsa. Different kinds of Mamsa can be made into paste and that also can be applied as lepa. Then next is Pitta Vidradi Vachanam. All those treatments told in Pitta Vidradi. That also can be done. That is about Samyak Dakta Chikitsa. Next it is Atidagda Chikitsa. Atidagde Vishirnani Mamsani Udhrita Shitalam Priyam Kuryat Bhishak Paschat Shali Tandula Kandanehi Tindugi Tokkabalerva Kritamishtrai Pralepiyet Pranam Guduchi Patrerva Chadayet Athavodage Priyam Chanikhilam Kuryat Bhishak Pitta Visarpava. So in Atidagda it is told like Vishirnani Mamsani Udhrita Shitala. So we have told that in the features of Atidagda when the burn is that much deep, we have told that there will be Mamsavalambana. Right, so that have to be removed. Vishirnani Mamsani Udhritya means that Avalambita Mamsa have to be removed and Sheetala Kriya. We have to go with certain Sheetala Kriyas like Lepa with Shali Dandula Kantana, Hindugitva. All these can be mixed with Krita and Lepa can be done. And another thing is using Guduji Patra, covering the part with Guduji Patra or any other Audagai, means Padma Utpala, all these leaves can be used. In addition, either with Guduji Patra or any kind of those aquatic plant leaves can be utilized. Example is told like Padma Utpaladi Patra. And Chade Tadavodahi, that wound, that prana can be covered with such leaves. Then Kriyam Chaniklam Gudyat, Hishak Pitta Visarpa. All those treatments told in Pitta Visarpa Chikitsa. That also can be done in Adidagda Avastha. So that is about Plushta, Durdagda, Samyak Dagda and Adidagda Chikitsa. So in first thing, Plushta Dagda, we have seen that we have to do only Ushna Kriyas because Shita Kriyas will cause Skandana, Rakta Skandana at the area. So we will go with Ushna Kriyas. In Durdakta, we have seen that we can do both Shita and Ushna Kriyas based on the Avastha. In Samyak Dakta, we have seen about certain drugs can be used for Lepa, and then Pitta Vidradi Chikitsa is also told. Next is in Adidakta, the Avalambita Mamsa have to be removed and Shitala Kriyas are told. Certain drugs have been told to make that Lepa, and another is using the leaves of Guduchi or other aquatic plants, that wound can be covered. That is the treatment. Another things told in this chapter is like Dhumopahata Lakshana and different kinds of burns. Dhumopahata Lakshana means when someone is afflicted with, it can be taken as inhalation injury or something like that. The condition due to inhalation of smoke in any kinds of burning in any circumstances when there is inhalation of smoke. When what is the features and what can be the treatment given for such a person? That is Dhumopahata Lakshana and keep it that is. श्वसति क्षौतीत च अत्यर्थम् अत्याधमति कासते चक्षुषो परिदाहश्च रागश्चैवोपजायते स धूमकं निःश्वसिति प्रेयमन्यन्न वेति च तथैव च रसान् सर्वान् श्रुतिश्चास्य उपहन्यते तृष्णादाहज्वरयुत सीदत्यथ च मूर्च्छति धूमोपहत इत्येषः. These are the symptoms too. This much is the symptoms. That is श्वसति क्षौति च अत्यर्थम् means it is an inhalation